Good afternoon, everyone. I'm Dr. Lavanya. I'll be talking on IVUS and HD IVUS. So coronary angiogram, we know, is the gold standard modality for the diagnosis of coronary artery disease and for guidance of angioplasty. The main limitation of angiogram being that we are seeing a three-dimensional coronary artery in a two-dimensional way. So this has led to the development of intravascular imaging technologies, which include both IVUS, that is intravascular ultrasound, which I'm going to talk about, and OCT, which my colleague will be talking about next. So what is IVUS? It's a sound-based imaging modality that employs the use of an intravascular catheter mounted with a piezoelectric crystalline transducer to generate ultrasound pulses and provides us real-time 360-degree cross-sectional images. So it basically has three components, a console, which you can see here. There's a pullback device and an imaging catheter. So how does the IVUS work? So this transducer, you can either have an automatic pullback or a manual pullback through the area of interest, and the crystals in the transducer, they expand and contract and produce high-frequency ultrasound waves. So these reflected waves at the tissue interface are reflected based on their acoustic impedance, and the reflected waves are converted to electrical signals, which we can then see as an IVUS image. So there are two types of IVUS system. There's a mechanical IVUS with a single transducer element, and there's a solid-state system with a 64 transducer element. So what does a basic IVUS image look like? There's a catheter, there's a guide wire, the equilucent lumen, and there's a vessel wall. So let me show you how this looks with the diagrammatic representation. So what you can see here is an enlarged image, the intima having the endothelium and the internal elastic lamina. The middle layer is the tunica media, which has a smooth muscle and external elastic lamina. And the third and the outer layer, also called the adventitia, with the periadventitial tissue. So there are various plaque morphologies. I won't go into the details, but this is how a soft plaque looks. The other end is a mixed plaque, and in between is a fibrous plaque. This is all based on echogenicity, similar to how we see on an echocardiogram. So some more morphologies: an attenuated plaque, a layered thrombus, and a dissection with a true and a false lumen. So the most important thing is what we're looking for is a stent. So basically the stent struts are strong reflectors of ultrasound waves, and they appear as high echogenic points, which you can clearly see here as interrupted line. That is the stent inside the vessel. And this is the calcium with the acoustic shadowing, so you can't see anything behind the stent. So what exactly are you using IVUS for? Any intravascular imaging for that matter. You are using it for a pre-intervention assessment, to prepare the lesion, and a post-procedure analysis. So you see where you're going to place your stent, what is the length of your stent, what's the diameter of your stent, and then you place the stent either by modifying the lesion, either by lithotripsy or atherectomy, and post-stent, you see whether it's expanded, or there is a malapposition, or there's a tissue prolapse. And HD IVUS is basically like your high-definition TV, more resolution, more lateral and axial resolution, faster, better quality, and more integration, faster acquisition of images. So I'll just run through a case of a 62-year-old gentleman. He's a diabetic and hypertensive since the last 10 years. He's already a known case of coronary artery disease and underwent angioplasty to the LAD and circ in the year 2014. So this time he's presented with unstable angina with elevated HS tropi. So this was his angiogram with the triple vessel disease. And you can see the LAD ISR here, the stent is occluded. So we proceeded with imaging-guided PCI. So we've used something called ELCA, it's a laser lithotripsy, which my colleagues will be talking next about. So post this is how an IVUS run looks like. So you're pulling back the catheter here, this is how it looks, and this is where I focused what is there inside the stent. It was an ISR, that is an instant restenosis. So post that, we used the laser and then used a cutting balloon. And then you can see the beautiful LAD flowing on the right-hand side, which is the final image, and a post-run IVUS, which looked like this. No more ISR, the stent is clean. That's an excellent result. That's how imaging helps in your day-to-day practice. Thank you for your patient listening.